Thank you very much. First, a couple of thank yous for having me here today is number one, and number two, for your patience, because I was supposed to be here yesterday, was stuck in traffic, and watched the minutes tick by as I knew that my 5 minutes before this distinguished panel was quickly approaching, and I was not advancing in that traffic. Secondly, I want to thank you all very much for your commitment and dedication to this really important work that you're doing by serving on this commission and undertaking this groundbreaking work in this country. Massachusetts is the innovation state, and we have innovated in so many different ways on so many different fronts, and having been the first state in the country that decided that every young person should have health insurance, and then that every individual who is in this Commonwealth should have access to affordable quality health insurance, and then that both of those led to national legislation and national action. And so we are innovating and we are working hard in the healthcare realm to make sure that everyone has access to quality, affordable care. And your role and your work in this is so critical as people who are trying to now help us figure out how to, without compromising that access and compromising that quality, to also control costs. And so I really commend each and every one of you for the commitment and dedication to this effort. The final thank you before I offer just a couple of substantive comments is to thank you very much for the work of this panel in the hard task of figuring out the regulations and the rules around the nurse staffing ratio in intensive care units. That was, again, another groundbreaking thing. One state in this country has adopted a law in this regard. It was an effort in this state that was undertaken by those who believe that that was the best course to do so here in Massachusetts as well. And it was the decision of the legislature, I guess a year and a half ago now, to work together to pilot this, test it, see how it works here in Massachusetts, and to evaluate it. And you had the hard job of figuring out how to develop those regulations, and you now have the hard job of figuring out how to evaluate it to make sure that we understand how it worked and what benefits may have accrued as a result of it, and to what extent that policy is workable here in the Commonwealth of Massachusetts in the context of everything else that we're working on providing this access and quality of health care. The two areas that I'd like to comment on, well, the first one is very quick, and that is when I was talking about the sort of thumbnails about health care in Massachusetts just a few years ago, I was using the figure $60 million for our health care cost, and heading into the low 60s and then beyond before this commission got established. The figures that I saw yesterday, $54 billion, if that is all in, then I guess there's a huge congratulations due to a lot of people both in this room and elsewhere, because we're heading in the right direction, again, assuming that it's not compromising quality and access. So I just wanted to highlight and comment on that, and if I am wrong and the reports are incomplete, I hope you will educate me at another time about where we really are, because I was saying 60 to 62 just a few years ago, and now I'm seeing in writing 54, and I need to understand that. And if it is really now 54, that is really quite remarkable. So the thing that I'd like to ask you to focus on is a particular cost center within our healthcare picture, and that's pharmaceuticals. And we are the leading state in research. We're in the top handful of states in manufacturing of pharmaceuticals, so we don't want to kill the goose that lays the golden egg. On the other hand, we know that Massachusetts, with its world-class teaching and research hospitals and its world-class universities, is the reason why every pharmaceutical company is beating their way to our door and is located here in Massachusetts. So I think we have a corresponding social responsibility after the state has invested $500 million so far on a $1 billion commitment to help grow the pharmaceutical and life sciences industries here in Massachusetts, that we look at the other side of the equation, and that's the cost. And my understanding, and I'm prepared to be corrected if I'm wrong, but that we're basically seeing double-digit increases, and in a typical year it's 12, 13%. I think the last reported year was 13%, and that our premiums reflect about 10 or 12% of our premiums is the cost of pharmaceuticals. So I think we have an obligation to work together as a government with the industry to identify ways of reducing costs and managing that cost center within our system. Every insurer that I've spoken with, needless to say, is all over that subject and very happy to hear me talk about it. And frankly, every provider that I've talked with is happy to hear me talking about that. So I'm looking for help in bringing together the coalition of people, the stakeholders, those who will be affected by the decisions, to craft a solution for Massachusetts. There are some models out there. We have some individual states. We have some regions that have formed. A notable one would be Washington State and Oregon, where separately and now together they've aggregated demand. And the result of that is on the formulary of drugs that are negotiated in aggregate in those two states. They're saving about 40% on the cost of those drugs. So we need some help. We need some leadership. And I've raised this at Jobs for Mass. I've raised this everywhere I can. And so when I heard you were holding this hearing today, yesterday and today, I said I need to come and ask you for help as well. So I just want to put that on your radar screen and ask you to think about, with all of the other spectacular and extraordinarily hard work you're doing, if you'll work with us to think about how in Massachusetts we can approach this problem so we can receive the benefits of market forces through aggregation of demand and get better pricing so that our folks will not be choosing between heat and medicine, and so that our businesses, our economy, our health care and premiums, insurance premiums, can see a benefit as a result of aggregation of demand. And so that's my story, and I'm sticking to it. So I thank you very much for your time, and if there are questions, I will do my best to answer them, although I'm far from expert. You are the much more knowledgeable people than I.
First, Senator, let me thank you for those of us who have fought the traffic in the audience. The fact that you had a problem makes us all feel a little better. That so that's very appreciative. And thank you for all your work. I mean, we stand here because of the work you've done, and it's a pleasure to represent Massachusetts and other parts of the country because of the work that you do. So thank you so much. Are there any questions, or Senator? Particularly, I want to your statement about our nurse staffing work. I really want to acknowledge the secretary because without her, we would not have been able to do nearly such a good job. So thank you.
Thank you. Thank you, sir.
It keeps on giving. We are very good at thinking about what needs to be done. We're not so good at thinking about how you actually do it.
And we are more than happy to work with you as much as we can with respect to drug utilization, drug pricing, and to do what we could. I know the work that's going on in the West. And I think that's a good model that we should be looking at in terms of how to use drugs, where do you get the best value for high-priced drugs. I think, it's not only focusing on the prices, it's focusing on how we use them as well. Mm-hmm. Thank you.
Thank you for adding that point. I haven't said that, and I should say that.
Well, that's a lot, yeah. I mean, when I look at Oregon, in particular, they have a very extensive group out there, and they're looking at these formularies, not only in terms of getting lower prices, but when to use the drugs and when not to. And obviously, we want to use drugs that work, but when they have limited or no impact.
See, I knew coming here would make a difference. You're already making a difference in the dialogue, so thank you. Seriously.
Yeah. Thank you,
So
Senator.
thank you so much.
Thank you
I
all
know
very
have
much. Have a
busy
good
day.
day.